would usually have my patients positioned like this. I'm not going to tell you that you can't have them on the table like this. Either would be fine as long as they're stabilized. And it probably depends on if I'm doing the index. Does it specify which finger on the test?
No, you can choose whichever one you want.
So if I'm doing the index MP, I'm probably going to have her stabilized like this. I'm going to say, go ahead and bring your hand all the way down into like this. I usually let them all do it all at once when I'm measuring it because it's difficult for them to just isolate that motion. But if it was just an MP injury, then I would really kind of support just proximal to that joint. Okay, go ahead and bring that finger down for me. Good. One or both. Good. See, you get more motion if you kind of do them all. So go ahead and bring all those fingers down. I'm going to gently pull her thumb out of the way. And then I'm going to dorsally put my axis right on that DIP joint. There we go. Good. And my stationary arm, see how I have to move this out of the way just a little bit so it literally is touching that first metacarpal the whole way down. I have to bend my goni up. And then I'm going to dorsally be in line with that proximal phalanx. So that's how you would do it dorsally. Laterally, I would have my axis right on the MP joint, be in line with that first metacarpal, get my finger out there, and then the same thing, be my finger of that proximal phalanx, and go ahead and read it there. So then she's got 95 degrees of MP flexion. If I'm doing her small finger, I have her up like this. Okay, go ahead and bring that hand down for me. Good. Dorsally. Good. So I have to kind of move that. I'm not on the dorsal aspect the whole way because I'm not touching her at the base here of her metacarpal. So I kind of bend that out of the way, and my axis is right on top of the joint, and then I am flat across that proximal phalanx. She's got 95 degrees of MP flexion there. If I'm doing it dorsally, or laterally, I'm kind of to the side, and it's really easy to do if my goni's not opaque. My axis is right on that MP joint. I'm parallel with that first metacarpal, on top of that first metacarpal, and then I am parallel to that proximal phalanx. Good. About 95.
And if you're doing digits 3 and 4 and you have the full round, then
Eyeball.
yeah.
So if I'm going to do her ring finger, I would do it this way. If I'm doing her middle MP joint, I would do it this way. So go ahead and bring those fingers down for me. Good. And it's a little easier because it's really similar to the other, but a lot of times they're not going to be the same. So I'm going to get that finger out of the way if I can. Sometimes you can't. And this is where my finger becomes my friend because I'm putting my finger on that fourth metacarpal. Good. So I'm parallel to that fourth metacarpal, my stationary arm. Good. And then I get my pencil or my finger and I lay it right on top of the proximal phalanx of that ring finger. Good. And then I get my goni to be right on top of there. So then she's got 83 degrees of index MP flexion. That's from the lateral side. Okay. That's whenever my goni's, if I can't see through it, I would never be able to really do that accurately. Or if you're doing it dorsally on the index finger, you got to bend your goni, if you have this one, kind of out of the way so you can get it flat on that fourth metacarpal and then flat on the proximal phalanx.
You can also test this. When you're testing this, a lot of people aren't able, because of their intrinsic weakness, are not able to get into that position. So it's also okay what we're testing when we have somebody who's had some sort of a fracture, and that's where we're wanting to measure this. Oftentimes you'll have a hand that looks more like this. So don't think that their hand has to be like that. You will often see their hand. This is what we're really measuring. And they don't have, you can just tell, I don't have full MP flexion.
Yeah. And a lot of times when I was talking about composite thumb flexion to the base of the small finger versus isolated IP, isolated MP, same thing goes for digits. This is composite digit flexion. Go ahead. So this is the quick way to do it. Can you go ahead and bring your fingers all the way in here to that DPC, that distal palmar crease? Good. So she's got full digit composite flexion to her DPC. Then I'm not going to have to measure anything because I know she's got full range of motion of her MPs, PIP, and DIP. Composite flexion. Now this is, go ahead and bend that small finger down. Good. Go ahead and really pull that down. Good. Now that's isolated MP flexion. This is isolated PIP flexion. because I'm stabilizing it. This is isolated DIP flexion. So whenever I say isolated versus composite, here's composite, bending at all three, flexing at all three joints of our small finger, versus isolated MP, isolated PIP, isolated DIP flexion. And you can measure either way. For the test, as long as you're measuring the right joint, that's all that we care about. We're not going to say isolated MP. We're not going to say composite MP. It doesn't matter as long as you know what I'm talking about. All right, so extension is the same thing. So if you're going to be doing it, you do it on the palmar side, I guess, of her hand. You can see I don't do it this way. Dorsally. Depending on your goni, you could do it dorsally, same way, or like I said, if you're laterally doing it, and I guess technically you could do it volarly also.
Because most people, it depends. A lot of people have some hyperextension here. And so if you're measuring it here, you're not going to be able to capture my hyperextension.
Unless your goni is like this.
Right.
So depending on your goni, it depends on how you can measure that. But just know what you're doing, MP extension. So I'm going to go for the lateral side. I'm in line with that MP joint of the small finger. I am parallel with that first metacarpal. Good, and then I am parallel to that proximal phalanx. So she has 30 or 25 degrees of small finger hyperextension.
So if she had none, you would say she has 0
Zero.
degrees
Of extension. Yeah.
Zero's normal.
So like 0 is
Your book says zero is the norm.
But doesn't everyone hyperextend?
Not everybody does, especially as you get older.
Right.
See, I'm not old, I have hyperextension. You know, because some people are really hypermobile and they will have a lot, and some people have just a few degrees. So the norm is 0 to 90, but know that almost everybody has hyperextension. So what you would want to do, if this is your patient, you're going to compare affected hand versus unaffected. So if their fractured hand goes to 0, but their unaffected hand has hyper, then I know I'm not to their norm.
Yeah, okay.
All right. So like I said, you can do that laterally or dorsally if your goni allows. But see, my goni doesn't allow to do it dorsally. Okay, and IP, same thing.
What are we on?
IP, flexion and extension of the digits.
Do you not have that?
There. It's the same thing. If we don't have the, can you not go down anymore to 34?
You have.
There we go.
Okay, there we go.
Okay, so PIP flexion, once again, you can do it compositely or isolated. So I'm going to do it isolated to show you that. So I am doing her PIP of her small finger. If I was doing her index, I'd have her down here. Okay, so I'm going to do her small finger, PIP flexion. Go ahead and bend that for me. Perfect. I'm going to put my axis right on her PIP joint. I'm in line with that proximal phalanx. And then I am in line with her middle phalanx. So she has 130 degrees of PIP flexion. Or dorsally, go ahead and bend that finger for me. Perfect. My axis is right on top of the joint. I'm going to get my goni kind of out of the way. So I am flat on the proximal phalanx, and then my axis is going to come up a little bit to make sure that I'm flat on that middle phalanx. So then she's got 115 PIP flexion there. Okay? Same thing with extension. You can do it dorsally. So here is your dorsal aspect, and so she actually has some hyperextension. So my goni's digging into her, so I've moved it to the side a little bit. So that's how you would do it dorsally on the dorsal aspect, or laterally. I'm in line with that PIP joint, my axis, and then I'm in line with the proximal phalanx. And then I line up with the middle phalanx, and she has 11 degrees of hyperextension of her PIP joint. And then DIP, the same way. You can do, let's do your index. So you see how I'm moving her arm. Your patients, you've got to put your patient exactly how you want them, right? Because they could be like way over here, and then I could be like standing on my head trying to have to do this. If you can get them in perfect position, you really want to, because where I'm at measuring makes a huge difference. Somebody measured my supination from the side. See how hard it is to really get accurate, your lines measured, if you can't be directly and you can see those joint motions, how difficult it is. So if you position your patient, that's gonna be you're gonna get the most accurate measurements. All right, so DIP flexion extension of her index finger. So I'm gonna go ahead and bend that small little thing in your index. Good. So dorsally, I'm gonna put my goniometer right on top of her DIP joint. I am good. Dorsally on top of her proximal phalanx, and then I'm going to be dorsal on her distal phalanx. So she has 100 degrees of DIP flexion. If I did it laterally, I would do it the same way. Or sometimes I do it compositely. Good. And then I can measure her DIP flexion compositely. So I always just document however I'm measuring. And I measure different depending on the different diagnoses. If it's a small finger ORIF, I'm going to probably do it isolated and composite measurements. If it's because she's got swelling because she had a car wreck and she's got tons of other issues going on, I would probably maybe just do it compositely. I don't know if this book shows you this, but sometimes if it's for a real quick and dirty way of doing it, like I said, if they have a car wreck and she's got so many other issues, and I can't have like 100 goals, right? So I really want to make sure that I'm documenting that she can't make a fist, that she can't have full composite flexion of her digits to her DPC. I need to note that, but I realistically know that it's because she has all this edema because of her compound fracture of her humerus. It really doesn't have too much to do with her hand, although it's important. So that's whenever I would do this type of a thing where I have her DPC and she's got edema, so she's gonna kind of look like this. So I know she's got limited flexion. So I'm gonna put my goniometer right here on her DPC and measure from her fingertips each one. So her index, she is 4 centimeters from her DPC. Her ring, she is 5 centimeters. From her long finger, she is 6, and from her index finger, she is 6.5 centimeters away from her DPC, rather than having to do MP, PIP, and DIP of each finger. MP, DIP. See how more tedious that is whenever she has all these other issues going on versus if she's got a small digit ORIF. So she had a fracture and they went in and put pins in there. So that's a different, I do both.
So just one thing that I want to make sure that you understand, so what Courtney's talking about is when we're talking about composite flexion, we talk about total active movement or total passive movement, and it's the amount of flexion at each of those 3 joints. So you could add up and come up with 270 degrees if they're pretty close, or you can do like Courtney just did and you can measure how far away they are. But to understand what composite flexion is, you have to document, is it active or is it passive? And it's the total movement at each joint or the distance they are from the distal palmar crease. And the book shows you both ways. Okay?
All right, let's break up and practice this.
Wait, you know what, we just have one more to do.
What is it?
Abduction, adduction.
Okay, so your starting position, your wrist and forearms are neutral, and your eyepiece are extended, and then go ahead and spread your fingers out as far as you can, and then you take with your ruler, with your centimeters from your middle, so I'm going to do my abduction of my index finger, so I measure in centimeters from the tip of my long digit to the tip of my index, so then this is 5.3 centimeters of index abduction.
They show you how to, they do it in degrees of motion in the book. So your axis is on the dorsal aspect of the MP joint of the finger being measured. Stationary is along the dorsal aspect of the metacarpal of the finger being measured, and the movable is along the dorsal surface of the proximal phalanx of the finger being measured. So
Where's the axis?
Sorry. Axis on the dorsal aspect of the MP, of the finger being measured.
Okay, so in between the two?
So if I, see that's not the way that I do it.
Sorry, they must have changed this one.
Yeah, I always did. Okay, so we would measure it like this. And so I guess that's your normal position. Let me check.
Can we just do
Your
measurement?
book just does some things kind of weird. So it's along here. Stationary, so this is our normal, yeah, so we're right here, and I'm just gonna line it up here, and then now
okay.
pull that over. And then I'm just gonna follow along.
Okay, alright. So, alright, so I'm gonna show you abduction of the index finger. So my metacarpal head is the axis. And my stationary follows that first metacarpal all the way down. Good. And then I'm in line at her mid proximal phalanx. Okay, so go ahead and bring your index finger out. Good. So she has 30 degrees of abduction, of index abduction.
And there is no norm, because the thing is, every digit is a little bit different, so the book does not give you norms. This would be one of those tests, is if I have an injury on my left hand, I would compare what the abduction is on that hand to the non-affected hand, and then that's way I'm going to determine, is this norm for this particular patient? If it's somebody who has arthritis, I think that's, how is it impacting them functionally? It's not a movement that we measure very often. You can measure for the test, you can measure the way the book shows you, or you can measure the way Courtney showed you, where you're just gonna measure the distance between.
Alright? Practice those. And anything else you want to practice?